Well, how to survive a heart attack. It is a CBS 42 News special report all this week on our morning news. Today, a look at the difference of heart attack warning signs for men and women. Catherine Tuttle is a physician, an avid runner, and a survivor of a heart attack.
On Easter Sunday night in 2012, I went to bed and I didn't wake up because at about 2 o'clock in the morning, I had a cardiac arrest.
She's fortunate she's married to a cardiologist who knew exactly what to do.
Apparently, I had a seizure that woke him, and he reached over and felt for a pulse, and I had no pulse. So he started CPR.
Because of her husband's quick thinking, Dr. Tuttle survived. It's important to know heart attacks can happen at any time. Dr. Saema Mirza is a cardiologist at Cardiovascular Associates, affiliated with Birmingham's Brookwood Hospital.
In cardiology, we say time is muscle, because as soon as you start having a heart attack, the quicker we can open your artery, the less damage you will have to your heart. And it's also life-saving.
Here are the most common warning signs a woman is experiencing a heart attack. Pain or discomfort in the center of the chest that lasts more than a few minutes, or the pain goes away and comes right back. It could be associated with sweating, or the pain spreads from the chest to the arm, neck, or jaw. Shortness of breath, tiredness, or upset stomach, unexplained anxiety, weakness, or fatigue.
Some women might experience these symptoms, but majority of the women, the character of the pain is not necessarily the same. It feels sometimes like a sharp pain, like a knife sticking in their chest, or it might just be in their arm. They might have numbness instead.
While men and women may both experience chest tightness or pressure and/or pain in the chest, neck, jaw, arms, or back, there are some warning signs for men that are different, such as dizziness, a cold sweat, along with shortness of breath and weakness or unusual fatigue.
As soon as you feel like you're having a heart attack, first thing they need to do is call 911. And while the ambulance is on their way, if they have some aspirin laying around, take 2 regular aspirins, chew them up because it will absorb quicker.
Now, most importantly, Dr. Mirza says don't ignore the warning signs and always discuss any concerns you have with your physician, who can refer you to a cardiologist if needed. Well, we're bringing you special reports all week. Tomorrow, advice from a fitness instructor on the steps you can take now to prevent a heart attack. Coming up on Thursday, local doctors will join us in our studios to answer your questions about a heart attack. And you can email your questions to reported@WIAT.com. We will have more on the warning signs of heart attack coming up at 7 o'clock as we do a Facebook Live right after this newscast. But certainly, as Dr. Mirza says here in this area at Cardiologist Associates, that you need to get in contact with someone. Call 911 immediately if you think this thing is happening.
Yeah, absolutely.
I think a lot of times people don't think that these symptoms could be connected to a heart attack, and they wait a long time. Right. And in the event that you are not practicing some of those really preventative things like eating healthy and the exercise, then time is really, time's of the essence no matter what.
Yes,
but
it's all about time. And you may not have any of those warning signs, just one could be the warning sign you have. But we'll talk about that more in our Facebook Live.
It's good information.